the video today, I'm going to quickly answer what are the side effects of naltrexone and Vivitrol, which many of you ask because so many of you are interested in this medication. Side effects, very simple, okay? The side effects are dizziness, vomiting, nausea, a little bit of anxiety, a little bit of insomnia. Is it really that bad? No, it's not really that bad. These are the major things reported on the drug label. And if you talk to most patients, they don't really feel too much of these side effects. The description I just stated is for the oral formulation, the 50 milligrams a day, or you can take 100 milligrams every other day. It is reported, and when you talk to patients, once you do the Vivitrol formulation, which is the intramuscular injection, these side effects are much less apparent and stereotyped. In the first place, they're not even that bad. So those are the major side effects which go away very rapidly once you get on this medication. Another side effect that's often cited and concerned, toxicity to the liver. Physicians call it hepatotoxicity, okay? This is a commonly cited side effect. What is a way to approach this? Have I seen any toxicity with this medication? No, not at all. A good rule of thumb for your physician, and this will be up to your caretaker, is maybe get a set of labs that show your liver enzymes before you start this medication. And if you're going to be on this medication for several months or even several years, every so often, 3 to 4 months, maybe every 6 months, to check a set of liver labs and enzymes to make sure nothing is going dysfunctional. There used to be a rule of thumb. If your liver enzymes are 3 to 5 times above normal, you shouldn't start this medication. Those decisions should be left up to your physicians. As far as you're concerned, there's very mild dizziness, nausea, maybe some vomiting, sleeplessness, anxiety, and mood disturbances right when you get on this medication. I think more interesting is the contraindications, which are very obvious in for this medication. One of them, which is the most obvious one, if you're pregnant or lactating, you shouldn't be on this medication at all. That's why folks that take Suboxone, which has some naloxone in it, switch to Subutex. But the other contraindications with this medication are you can't be on opiate medications, because the minute you take this medication and you have opiates on board, you will have what's called precipitated withdrawals. And that is basically your regular withdrawals on steroids, okay? So that is a contraindication, not a side effect of this medication. You know, we said compromised liver function, we said pregnancy, we said lactation, and those were the contraindications. And finally, if you are on opiate medication. I'm going to lead into one more thing here, and oftentimes people ask about this medication, which is in their Suboxone. Naltrexone, another formulation of it, naloxone, is in your Suboxone. Naloxone and naltrexone are exactly the same thing as far as you're concerned, except naloxone is a rapid-acting version that is often used in the emergency department or out in the field for opiate overdose reversal. That is the form that is put in your Suboxone strip. When it's in your strip, it is not biologically active. So you hear a lot of people saying, I'm allergic to this, I don't want this, I don't want this, it does this to my brain. It actually is biologically inert. The only time that naloxone gets turned on, the naloxone that is in your strip, is if you were to somehow grind that strip up, dissolve it in some liquid, and inject it intravenously. At that point, the naloxone gets turned out. That's it. The contraindications is if you're using opiates, don't use this medication. If you're pregnant, if you're lactating, you don't want to use this medication. This medication in your Suboxone is not even biologically active, so it's not doing anything to you when you take your medication the right way under your tongue. And finally, some of the side effects and safety issues: nausea, vomiting, dizziness, insomnia, and anxiety. Those are the side effects of the medication. Please be advised that you should always consult your physician, talk to him extensively about if this medication is right for you, what are its side effects for you, and how you should take it. Thank you very much. If you want to learn more about Suboxone, click right over here, and there's plenty of information about Suboxone there. Otherwise, have a wonderful day, and please subscribe.